I feel strongly about this issue because I've seen the shocking reality for myself in my constituency at East Surrey Hospital and also in St Helier Hospital, which is outside of my constituency but serves some of my constituents. So in those hospitals, patients being cared for, they're being cared for in spaces never designed for clinical treatment, and staff are trying their best to do their jobs in entirely difficult and impossible circumstances. And I really cannot imagine how upsetting it must be to go into hospital with a serious medical problem, only to spend hours or more on a trolley surrounded by noise and footfall without any sort of privacy and denied basic dignity. In fact, I saw one example of a patient that was near the automatic doors that were effectively opening and shutting every time someone walked past them. It's just not dignified or appropriate in any shape or form. So, and how can it be right that doctors are forced to discuss private medical matters with patients in public hallways or even attempt examinations and treatment without the facilities they need close at hand? And to be really clear, all the staff I met on my visits were doing the best they could in extremely difficult circumstances. The problem was not down to their lack of either commitment or compassion. It was a system operating without enough physical space to meet the excessive demand now placed upon it. The previous Secretary of State did promise to eliminate corridor care by the next general election in 2029. So I think what we need to understand is how that is going to be addressed. I think we all accept this is not an easy thing to solve, but it would be good to understand what measures and steps will be taken to address this big issue.